Hi, my name is Ressi. I'm an occupational therapist and certified lymphedema therapist. I specialize in oncology and breast cancer rehab. Today I'm going to show you how to perform exercises after surgery for breast cancer. There are two phases of exercise. Phase 1 are simple exercises for the first 2 weeks after surgery. They will help improve your range of motion of your arms. Phase 2 includes more aggressive stretching, usually performed 2 to 4 weeks after surgery. Every surgeon may have a different protocol for activity and range of motion. So it's very important that you discuss with your surgeon whether it is okay for you to begin performing these exercises. You can begin by doing diaphragmatic breathing exercises. What that means is you're going to expand the belly and the diaphragm to help improve circulation and lymphatic function. It can also help with relaxation and reduction of tension in your muscles. So it's not a chest breath. You're not going to breathe like this. Instead, you're going to breathe from the belly. You can place your hands on the belly, and when you inhale through your nose, your stomach will expand. When you exhale through your mouth, your stomach will relax. Take a deep breath in, nice and slow. Exhale through your mouth, and your stomach will relax. You can repeat that 5 to 10 repetitions. While you're seated, begin by elevating your shoulders up and down, up and down, up and down. You're going to repeat that 5 to 10 repetitions. Roll your shoulders forward. Repeat that 5 to 10 times. Roll your shoulders backward. For this next exercise, you're going to squeeze your shoulder blades together. You may feel some discomfort along your chest. Do this exercise gently as you can tolerate it. Clasp your hands together and use the other hand to help raise your arms. With your elbows straight, raise your arms to about shoulder level. Each time, you're going to try to go a little bit higher. If you have any drains, you may feel a little pulling sensation at the drain sites. Do these exercises with caution. Try to raise your arm on your own. Again, you're going to start by raising it to about shoulder level, and each time you move, try to go a little bit higher. One thing to pay attention to is your posture. You want to make sure your elbow is straight and not bent. And as you raise your arm, keep your head straight. So you're not going to do this or bend your elbow. It's very important that you maintain an upright posture with your head straight. So again, you're going to raise your arm straight in front of you, keeping your head straight. I'm going to demonstrate that exercise again from this position so that you can see my posture. You want to make sure you are sitting up straight and your head is straight. When you raise your arm, be sure not to hike your shoulder blades. So, for example, when you raise your arm straight in front of you, don't let your shoulder come up. Keep your shoulder blade down. So again, head is straight, elbow is straight, shoulder is relaxed. You don't want to do this, hiking, bending the elbow and tilting your head. That is not good range of motion or good position for your arm. Head is straight, shoulder blades are down, elbow is straight as you try to raise your arm. If you feel that you are starting to hike your shoulder and tilt your head, then stop where you are until you can perform the exercise with the right posture and positioning. Place your hand on the back of your head. Move your elbow in and out. In and out. Again, make sure you are not hiking your shoulder while you do this exercise. Keep the shoulder blade relaxed as you move your elbow in and out. You can also do this exercise while you're lying down on your back. Place your hand behind your head, move your elbow back and forth. You're going to repeat that 5 to 10 repetitions. With your palm facing up and your elbow straight, raise your arm as high as you can. Try not to bend the elbow or hike the shoulder as you do that. Elbow should be straight, shoulder blade is down. Raise your arm as high as you can tolerate it. You can start by moving toward the shoulder height and each time go a little bit higher. Reach your hand behind your back, clasp your hands, and rock your arms from side to side. Bend both elbows up and down to help improve the circulation of your arms. Move your wrists back and forth, up and down. Open and close your fingers to help improve the circulation. All of these exercises can be performed 5 to 10 repetitions, 3 to 5 times per day. Again, please make sure you've discussed these with your doctor to ensure that it is okay for you to begin doing these exercises. Phase 1 exercises can be done during the first 2 weeks after surgery. If you're ready to move on to phase 2, watch the next video so that you can progress with your exercises. You can use your arms for simple activities at home, feeding yourself, brushing your teeth, and washing your face. You can even reach for simple activities. I hope you found this video helpful. For more content, don't forget to subscribe, and I wish you well with your recovery. Thanks for watching.